Well. It's 7:30 in Dubai. It's 9 p.m. in India, and we are live. Unfortunately, today I'm going to be the only one hosting the show because our studio is under renovation. Lester's busy at home. There are things being done and enhancements made. So I'm going to be the one who's hosting our show today. So, Judy Carroll, thanks for coming in. Where's our Lester? I just said, what's the issue? I just told you where Lester is, so he won't be with us today. I'll be hosting the show all by myself, and I hope I do a good job. So you need to support me, start inviting all your friends, family, and do whatever needs to be done to make this one big happy family and one big live event. I hope I'm loud and clear, and I hope the audio is okay, the video is okay. I'm doing this from home, so please bear with me if anything goes wrong. Well, first of all, good morning, good afternoon, good evening, or good night, wherever in the world you are. Today happens to be the 4th of June on a Friday, and we are with our next episode of Tea Talk with TNGlive. I just want to say a big thank you to all of you who prayed for me and also for your concern. As I'm human after all, I needed some healing. I was a bit low for the last couple of days, but as they say, storms never last. So this also will pass, I'm sure about it. I have faith in my God. Many of you messaged me on Facebook, sent WhatsApp messages, and also called me, but I didn't answer any of you as I just needed some me time. Good to know that I have so many true family and friends who care. God bless you all. Have a wonderful day. Stay safe and enjoy this talk show that we're going to be having today with a young, dynamic live wire, as we call her. From the day I saw her on TNG, we called her a live wire because she came in there and she posted some of her dance videos, which was amazing to watch. Well, I'm talking about none other than Dr. Venetia Quadros, who's now an Abrio, obviously, because she's married to Noah Abrio. She lives in Mumbai, so she's Indian by birth, lives in India. She's going to be joining us very soon. But before I invite her into what I call my studio or the platform that we are live on, let me tell you a little bit about Venetia. She is a consultant physiotherapist who passed out as a Rajiv Gandhi University topper. She has over 10 years hands-on experience in orthopedic, neurological, and pediatric rehabilitation, expert in dealing with cases of arthritis, spondylosis, frozen shoulder, knee, hip, and ankle post-ops rehab, disc prolapse, cerebral palsy, and CTEV. Whatever all this means, I have no clue, but we're going to be talking to her, so she's going to explain to us. She also won the Youngest Leadership 2020 at TMC, worked for many NGOs like National Association of Blind, NAB, Leonard Cheshire Homes, etc., and set up rehabilitation centers for them. She worked at Jupiter Hospital and then started her own clinical practice. She has two personal clinics in Charai called as Movement 360, with one clinic for orthopedic and one for pediatrics. Certifications that she has along the way collected and received and being honored with are the proprioceptive neuromuscular facilitation. It's so hard for me to pronounce these terms, Dr. Venetia. I'm sure it's going to be very easy for you. But for me, these are terms that I haven't been using very often, so it's not easy. She's also received certification in sports screening, kinesiotaping, physical fitness testing and sports-specific assessment, manual therapy, cardiopulmonary physiotherapy, thesis on musculoskeletal injuries in dancers, and movement therapy. Anything left, Dr. Venetia? I'm not sure. I'm sure there are more coming in future. So these are the things I read just now about the one and only Venetia, who is a doctor by profession, but also loves dancing. We're going to be talking to her in a minute. I'm admitting Dr. Venetia into our studio. Please be there to cheer her on. Today we don't have the applauses and the claps and all the music and everything else. But what we have with us is one dynamic live wire lady a good-looking young lady. There she is, Dr. Venetia. Can you hear me?
Yes, Alvin, I can hear you.
Lovely.
Hi, Alvin.
Hi. Doctor, I'm not used to calling you Dr. Venetia, but for today, I'm going to be calling you doctor because you are a doctor. I've always been calling you Venetia as a friend, and I hope you don't mind it. But today, let's be a little professional.
It's absolutely fine. I've like known you for so long now, and thank you for that introduction. I love the way you pronounce each and every word. It was fun.
Yeah, because for me, these are not easy terms, right? I know a few of them, yes, but most of them are not easy for me to be pronouncing. It's a bit hard, but I tried my best. You're looking lovely, first of all. Uh, Dr. Venetia, I think you're using your earpiece, right? You think it'll be better without it so you don't get an echo? Just try. I can hear an echo a little bit. There's a feedback. Maybe just try and see how it is.
Is this better? Better?
I think it's better. You can hear me, right?
Or I'll just try using another headphone. See if this is better.
No, sometimes the earpieces, cause a little bit of echoes.
Better?
Well, we'll try it as long as everybody can hear. Well, Lynette John says, awesome, Dr. Venetia Quadros. So first of all, welcome to everybody joining us. I see Nigel Galway. Hi, Nigel. Hi, Ernest. Hi, Judy. Hi, Sweeney Maria. Hey, Sweeney, good to see you here. Are you still in Mangalore? Are you back in Dubai? We have Lynette. We have Shay Rock. Brother, good to see you, bro. It's been a long time. It's so nice to see him live over here. I'm going to keep saying hi to a few people as and when they log in. It's not going to be easy with all the comments that I keep reading, but please bear in mind if any of you have any questions pertaining to all those terms and technology and whatever they were I read out, please feel free to put them in your comments. I'm going to be trying and reading them out to Dr. Venetia so she can then probably talk a little bit about what you ask. Hi, Nicola. Yes, I see you too. I'm going to try and multitask today. It's going to be hard, but you know what? Nothing is impossible. Everything is possible. So, Venetia, so lovely to see you. Thank you for accepting to join us today. Thanks for the acceptance of our invitation to get you and come and talk to us today about your profession, about your personal life, about things you like, maybe things you don't like, and whatever you feel like talking about, even if it's on TNG or the people on TNG, we'll save that to the end probably. But before that, let's start about you. So you're in Mumbai. You're based in which part of Mumbai, Dr. Venetia?
Thane, from Thane.
Thane. Okay, it's breaking up a little bit.
Yeah.
Okay, lovely.
Yeah.
Thane. Okay, so we have Shay. Hi, Shay. He says, yes, I hear you guys crystal clear. Greetings from London. Well, he's a great supporter of TNG, I must say, and he inspires.
Welcome.
Well, he inspires me a lot because he does comment quite a lot on the post and he does give me a lot of advice. Thank you, bro. Love you. Thank you for all that you advised me on. All right. So coming back now to you. I don't know, something with the video. I think it froze. It says something was wrong just now. Guys, if there's any problem, please let me know and give me feedback because I wouldn't know what's wrong. Okay, I think the questions we should save for a little later because we need to ask Venetia, first of all, a few things about herself. Let her talk about herself and then we'll ask her questions. I already see Sharon Coelho. Hi, Sharon. That's another moderator with us. She's in Canada, in Toronto, Canada. She has a question. And then I also have Lynette asking a question, but let's wait for those questions. And we'll come back to questions a little later. For now, Dr. Venetia, let me ask you, I know you're a physiotherapist as well, yeah? But let me ask you one question. Why did you choose physio as your career?
Okay, so years back, I had seen like someone, in my close relatives who had a stroke. And, she was on a bed for quite some time. And there was a therapist who used to come at that time at home and, like she got on her feet so soon, like within 2 months, she was back to all her daily routine and activities. And that really inspired me. I thought like, wow, what a profession. I mean, you get to serve people. It's more like a personalized touch with everyone. And you're back to your routine just like in 2 months. So, from there, I was like inspired, like, I can also change lives and touch lives in a more personalized way. Like, when I understood when you're personal touch, when you have more communication, when you're dealing more closely with everyone. So, that like really inspired me, and then I didn't look back ever, and I just wanted to go ahead with it.
Wow, that's interesting. First of all, I was going to say you look young. I know you are young. It's not just looking young. you, you're very young. You've achieved a lot. You've studied a lot. You're doing a lot. You worked in the field for a long time, and then you started two of your own clinics as well, as for what I read in your bio. So all this at a very young age. First of all, I must say congratulations. Well done. And I think at this age, what you've achieved is probably just the start or the beginning, as they say. And I'm sure there's a lot more for you to achieve in future. You have a long journey ahead of you, and I'm sure you're going to be doing wonders. For which I think all I can say again is congrats and all the best. Let me come to another question, which is uh, what was the starting years in your career like?
Sorry, I couldn't hear you.
What was the starting years of your
Okay.
career like?
Okay. So I'll tell you, when I just finished my studies and I had to start up. Like usually people start up with hospitals and a lot of other type of clinical exposure. So for me, it was more like a ground level work because I worked for NGOs. So when you're working for NGOs, you're more, into slum rehabilitation. And there, people are not easily accessible to facilities like, a scan, MRI, and, X-rays and other things like even awareness thing, the awareness part. So when I had to work at that level, it was very, very challenging. And the best part about it, I learned that you need to get more in depth about observing things, about the way you see symptoms, because that time everything was like, even to do a scan like from the NGO, we had to get things arranged, we had to get everything easy. I mean, you have to make things available for them. It was a difficult task. So I learned from basics how to get there, how to work at that level, how to counsel the patients. Half of the problem is, people need to understand what's the root cause of the problem. And explaining to people who are not more, exposed to more medical facilities, more problems. They're very unaware of half of the things happening around. So it was a bit challenging job, but then I learned a lot. I started like more mixing about with people. I learned like, where the problem was, the root cause of the problem, and how we can, get them back on their feet. Like most of them were like bedridden at home for like so many years. They didn't even know what was their medical condition. So it was challenging. I worked with a lot of social workers. Worked with a lot of speech therapists. We had a big multidisciplinary team. We used to organize camps, free camps, so that people, more come into it. Then I did a lot of health awareness, so these I used to go and do workshops, and workshop is not be in English. We used to do it in local language like Marathi, Hindi, and explain to people, create more awareness. So that was more challenging, I feel, and it was very nice. It was a very great experience talking to people, knowing them in person, knowing their problems. It was a really fantastic experience. I spent years doing this, counseling people also. So, I mean, the start of the career was a little difficult, but then finally it started turning out more interesting as I got to interact with more people, more awareness. And I did a lot of health awareness workshops, even I trained a lot of nurses also. Like about disability, people have very less awareness right now about, when it comes to disability. People think if you're differently able, this is your capacity. Like they limit yourself. So it was more like, this is not what you are. You can do more than this. So it was more about counseling the parent, the counseling the child, counseling the people around you, and accepting the condition. Like acceptance is the biggest thing, which really is difficult. So that's how my career started.
Wow. By the way, welcome Sneha Nair. She's in the house. Thanks, Sneha, for joining in. I see Lester saying hi to us, by the way. And strangely enough, he's he's on his mobile, but
Hi,
it's
Lester. Missing you in this conversation.
yeah. So he is there, and he says you guys are looking good and sounding good too. I'm watching on my phone, and the funny part is, I see that Venetia has responded to that. So I'm sure Noah is the one who's responding on your behalf. Thanks, Noah. Good job. He says TNG Studio. Thank
Yeah.
you. Sound and video is perfect. That's really nice. By the way, those of you who are watching, all our viewers, please, please, please tag and invite all your friends. This is going to be a very good session because you're getting free advice from a wonderful lady sitting over here with me. She's actually right beside me. She's next to me. Dr. Venetia Quadros, who is going to be talking about a lot of issues related to your pains and aches and rheumatism and all kinds of issues related to your joints and what you can do to help out when you're sitting at home and things like this. So most of you, I'm sure almost all of us have these issues, whether we're young or old, it doesn't matter. We never know when it affects us. So please get your people on, let them listen to this, put your questions out. Lynette, I will ask you to retype your question in a couple of minutes so I can ask Venetia those questions. Sharon, you had a question. Please feel free to type it out and I will ask her as well. Dr. Venetia, by the way, when you do all this, I'm sure it must be a very busy day for you. I'm sure you have a, a tiring whole day and weekends because you run your own clinics. But does that give you time for yourself? And I know you're newly married. May I ask how long you've been married? When did you get married?
I got married in 2017. By God's grace, I have like a very, very, very supportive family, nice in-laws, a wonderful husband who like mostly does all my video editing in terms of, if I have to upload a video or a dance video, a very nice family, a very nice, I stay close to my family. So, it's easier to get things done then, this support matters a lot. So even my brother, even so anything required, they're always there. That's the way, that's the only reason I can work so much and do so much. Otherwise, it's really difficult. I mean, they don't complain also, even if I give him less food or whatever, he just adjusts with it.
That's the way it should be, I think. And you're blessed to have a very supportive family, especially a supportive husband. Noah, well done. Congrats, Noah. I think you deserve a big round of applause for that. You need to support each other because if one is a career-oriented person, it's not easy to pursue your career, especially if you don't have support from your family. And especially being a doctor and running your own clinics, I think calls for a 24/7 work time. I don't think there's a way you can say no to somebody who is in need. But I'm sure you balance your work life and your home and family life pretty well. And that's only because of the support of your family, which is very good. So all those listening, it's very important. Please remember, you should support one another. Never look at the other person and feel inferior, thinking that he or she is doing better than me. So why should I support? No, you know what? Everyone has their own way of doing things. God has blessed us with talents or probably careers or jobs or whatever it is. Support the person. If you feel you need to cook at home and clean at home, and if you're a man, so what if the woman is working and bringing the money home? There's nothing wrong with it. Yeah. Support her because she'll do better, and all she's doing is working hard to run the family. So it goes for men, it goes for women, either which way. Well done. I pray for you and your family, and I hope they continue. I'm sure they will. They will continue to support you. All right. In all these times, I think let me look for Lynette if she's got that question. Lynette, if you're listening, I'm going to scroll back. She's put it out again. Okay. Lynette John, can I ask you a question now before I go to further questions, which I want to ask you myself? But meanwhile, Lynette John would like to know. She says, my dad has been suffering from bad arthritis. He's been on painkillers and injections. How can he feel better without injections? If you're in a position to answer, please feel free.
Yes, I just wanted to ask RA, or is he suffering from osteoarthritis, like a knee pain, or it is like general body arthritis?
We just lost you for a few seconds. We lost you for a few seconds. Can you repeat your question again?
Okay. So, just wanted to ask Lynette if her dad is suffering from RA or osteoarthritis.
Okay, Lynette, if you heard that question from Dr. Venetia, please answer it. Then I'll ask her back again so she can clarify what you want to know about.
Okay.
Meanwhile,
Anyways, like
okay, she
I'll
says,
just,
no, she
yeah.
says it is RA arthritis.
Okay, okay. So okay, so RA, your medications are really, a little stronger medications. So what you can do is, depending on where your dad has issues more, suppose if his ankle is affected more or his wrist is affected more, there are specific exercises which reduce the stiffness. So, once the stiffness reduces, the inflammation in the joint reduces, and automatically your pain also, there is a lot of drastic reduction in it. So, there are specific exercises, like especially when it comes to your dad, he should try exercising at least 2 to 3 times in a day, so that he does not develop more deformities or contractures. Contractures means, if your joint is fused in a particular way, so later when you try to move it, there is excessive pain. So what I usually do is, when there is an initial stage of arthritis and a patient is coming to me at that particular time itself, I start off with basic exercises, and depending on where the painful area is, I work on the painful area a little bit more. So Lynette, what I would suggest is, you can get in touch with me also personally, since I know Lynette. So I can suggest specific exercises, especially for your dad, depending on which area is affected more. So in that way, the joint stiffness will reduce, the pain will also reduce. So in RA, I'm telling you, I have seen a lot of cases, and the best thing to do is exercises. Slowly, your pain, inflammation, stiffness, even your spine doesn't get stiff, your movements don't get slow, because later on, as you keep progressing, the movements start reducing, the joints start becoming stiffer, and especially the morning stiffness pain is a little bit terrible. The morning pain is the worst pain. So what I would say is, you do specific exercises. If you can get evaluated by a physiotherapist nearby, or definitely get in touch with me, I can definitely help you with that. Since I know Lynette personally, we can definitely communicate and talk on that. I'll give her a more personalized plan, especially for her.
There you are, Lynette. Thank you very much, Dr. Venetia. That was very sweet, Lynette. Yes, she knows you very well, because she knows that you're part of TNG, and they all listen to you sing as well, like Connie Francis on TNG. Uh, she answered your question, Lynette. I also have a similar question from Sharon Coelho from Toronto, Canada. She says, my mom has chronic RA and is on a restricted diet with steroids. Is there any natural solutions to alleviate the pain?
Exercises are, but depending, as I said, until you evaluate and know, like suppose in a clinic, I get to evaluate the patient. Every person is different. You can't have a general approach for everyone. So if I get to if I get to know like how much is the pain factor, or how much is stiffness, or how much is the range, then you have to work on in a specific manner. Especially when if it's age related, you have to go very slow with the exercises, no vigorous exercises, because some of the senior most population, the senior citizens, are prone to osteoporosis, so their bones are very brittle, so they're very, even the exercises have to be given in a very focused manner. So we need to look at the report, scan, and then we get an idea about how much specific exercises has to be done in regarding their condition. One more thing I need to tell people is, whatever you see on the internet, just don't follow it randomly. These days a lot of things are happening on the internet, and everyone thinks that in general, oh, these exercises are core exercises. Oh yeah, I can do them for my back pain. It does not work like that. So everyone has a very different body, a different issue. Like there are some exercises, like I'll just give you a simple example. Like suppose you have a disc prolapse, okay, a disc prolapse, a bulge, and you've not been able to lift weights, and you see something on the internet. Oh, plank is helpful, or crunches are helpful. Let me tell you, crunches can increase the problem about tenfold. So what I'm trying to tell people is, not all what you see on the internet you should go ahead with it. Always take a professional opinion for that. Know what is your problem. Once you understand what is the root cause of your problem, then you go ahead with it. Because I see a lot, during lockdown, everyone posted videos. Oh, let's start working out together. Let's do this together. And post lockdown, I had so many cases in clinic. They said they were working out, and because of the wrong technique, they had all these issues. So I just want to tell people, since a lot of people watching here, that not all what you see on the internet is true. So get yourself assessed and then go ahead with what you need to do ahead.
True. I think we tend to always watch what's on the internet. We always try to, the moment something happens, we Google and we think everything on Google is perfectly right. Google is right in many ways, I guess, but it all depends on what you're looking for. We shouldn't be looking at Google every time for even medical issues and so many other things that we think Google has all the answers to. Yeah, Google is a helpful tool. I don't deny it, but it's not for everything. There are things we need to consult. There is a doctor. We need to go to a doctor. There's a pharmacist. We go to a pharmacy to buy medications. You don't sit and say, okay, I have painkillers. I have pain in my neck. What do I take? Okay, you get a dozen things that come out on Google. Immediately go online, deliver these things to my house, and you start popping tablets. Just doesn't make sense. I think we need to get professional advice, which is very important, like the good old days. It should still prevail. Internet is there to help us, to guide us. And then, of course, we need to decide on what's right and what's wrong, not just to go with everything that we see over there. Sharon, Dr. Venetia explained, I think, pretty much in brief as what she can. I mean, I think the max she could tell you, but of course she needs to know mom's age as well, because a lot of this is age related. And as she said, bones are brittle. You have to be very careful as they age. You cannot go and do strong exercises and do things you're not supposed to be doing as well. So what I suggest towards the end of the show, I'm going to ask Dr. Venetia to read out her email address so that those who want to get in touch with her, please understand it's a business as well. She's a doctor, she studied, she's running a business. So as much as she can help with certain information, I'm sure she'll be more than happy to help. But if it gets to a little more detail that is required and there's a charge, please make sure that you discuss all these things with her prior to getting any advice, because it should be fair to both sides. Yeah. So we'll come back to all the details later. Just one thing, Dr. Venetia, your phone was, sorry, when you were talking, you keep breaking up. We had the same problem actually last week with another guest on our show. And I told her to take off the earpiece. It worked very well after that, because what's happening, I see your curtains blowing. I think there's a strong wind. It's picking up all the sound because that's a microphone. It's a condenser mic. It's picking it up, I think, and it's distorting the sound is what I feel. Just try it for some time. You can hear me, right, if you take it off?
You can hear me now?
Yes, very well, actually. We'll try for at least a minute or two and see how this goes, yeah? Nicola also says,
sure.
Even I have neck pain and what did she say? Where's the message gone? She said, even I have a lot of neck and shoulder pain. Nicola, I think your pain is nothing. You're young and hale and hearty. I think your pain is only stress, nothing else. I'm just joking. But Nicola, if you have any specific issues, Dr. Venetia, we can always get in touch with her. Others, if you have any questions, kindly feel free to put them out in our comments. I will definitely ask Dr. Venetia as much as we can fit in during this 1 hour. We've got another 30 minutes left. Within 30 minutes, I'll try and see what we can fit in. You mentioned about certain cases. You did speak to two of our guests as well. Sorry, our audience over here about RA issues. What, according to you, Dr. Venetia, in all these years that you worked with patients and studied as well, what were your most difficult cases that you have seen during these few years?
Okay, I'll tell you the most challenging cases I have seen. I have seen a patient who was bedridden for 25 years and she used to crawl at home. She was an artist and she was super talented. An artist who used to do all her artwork with just one hand, and she couldn't walk. For 25 years, she stayed indoors. Okay. So I got a call from the hospital and I had to see this case. And I went to her place since it's very difficult for her to come to me. So I usually don't do visits, but somehow sometimes you say like God has planned something for you and you reach that particular spot. So I went to her place and I looked at her and she said like, I'm an artist. And she spoke so well. And all she wanted to do is she wanted to stand. And she told me one thing. She said, once I stand, madam, I'm coming to your clinic. I was like, okay, we are getting there. We'll get there. But let me tell you, this process was not an easy process. Since she was already 25 years, there were contractures involved. Her muscles were so tight. There was a lot of deformity involved. She needed a lot of splints involved. She needed at least 5 people. She was overweight because she's never left the house ever. So, 5 people at least were required, all her family members, everyone to make her stand. But her willpower, I'm telling you, her willpower was amazing. The patience her family member has was amazing, and they had the faith in me. So the most important is you need to trust your doctor. Okay. So if you have the faith that I'm going to do it for you, I'll do it for you, however long it takes. And let me tell you, this process was not easy. It took me 5 years, to get her from standing to walker. And now she's independent and she's on a tripod stick. And she does
Wow.
all her activities all by herself. So that was like, one greatest achievement. I feel so happy, when I see her, the joy, her transformation, her positive attitude, and now she's running a business successfully. She's doing really well. Her own art business, and her artwork is going really well. Her digital business, everything she's doing really well. And now she's also searching for a life partner. So I'm so happy, things like work, everything according to, but it takes a lot of patience. So, people think that rehab is an easy process. It's not like that. It takes a lot of time to relearn things. We are all born, knowing to, like, we know how to walk, how to do things. But, relearning things are more difficult. And there's small achievements. Might be just standing doesn't make us happy, but for them, even that standing is everything. The joy they have is everything. So, I felt like that was I see a lot of challenges. I see a lot of kids who are working up to like 13 years, 14 years. Some people who had back pain for like 3 years. And nowadays, a lot of kids coming in with back pain because of the online classes going on, lot of online studies, online classes. Yeah, texting. Yes, text next syndrome. Alvin, have you heard of text next syndrome?
I
So that's like a condition. Yeah, I'll tell you, our head is like approximately is like a approximately it weighs around 4.5 to 5 kgs. Now, what we are doing is constantly when we are looking down and we are texting, we're putting a lot of load on our neck region. Okay, so 5 kgs of neck. When I'm moving 15 degrees forward, I'm putting approximately 13 kgs weight on it. Now imagine if I move 45 degrees forward, slouching and sitting, typing, or just texting, I'm putting approximately 30 kgs of weight. So my 5 kilo of poor head is going to take 30 kgs of weight now. And just imagine they start getting tingling, numbness. Small kids, even sitting one side continuously and attending class, the spine is shifting. So I think you need to tell kids about how to sit, and even people working from home, how to maintain an upright posture. And a simple trick for this is what, while you're attending online class, all you do is make sure that your screen or the laptop or whatever, the phone, the screen is at your eye level. A simple hack. So you're not slouching and you're sitting, you're not like that continuously. A simple hack. Just keep it at your eye level. And even if you're like if you're doing a lot of texting, I would tell all the younger generation is, please, there's something called as voice note. Please try to use that instead of like just going on texting, because that's going to cause again thumb pain, inflammation of all this tendon. Slouching sitting also, make sure you have a good chair while you're sitting. Even laptop. See, not everyone was equipped. Before this pandemic happened, we were not prepared. Our home environment itself was never made according to the work environment. So what you do is like, even if you do not have like a specific, work station at home, all you need to do is just stack some books up or take a cardboard box and just keep your laptops. Right now I've kept cardboard box and kept my laptop screen over it. So simple things, everyone is going online shopping and, I'm buying the best possible things just to, to feel, oh, this is going to work. You don't need to do. You just need, on YouTube, I have a YouTube channel and I share a lot of information on that. You can just look up to it. You'll find there. I've given you all simple tricks. Whatever is available at home, how to use things. Like, right, like I said, I just stacked the cardboard thing and stacked books up, and I've kept my laptop screen at my eye level. And now I'm talking to you. Or, if I have something, I use you just use an external keyboard or a mouse. And even if you don't have that, just slant your laptop and then try to type. All simple hacks, but all you need to fix and do. You don't need to buy a workstation and change everything at home. And plus, one more simple hack is, just while you're sitting at home, roll a towel up, okay, and just keep it. Alvin, you should also try. Just roll the towel up and keep it in the lower back region. So, you engage your core and you automatically sit upright. Don't need to do anything else. Don't need to change your chair or, buy an expensive brand. And people are like, these days, a lot of online shopping happening. So, just get the best brand and they think that they can fix everything. But it doesn't work like that. Everyone's spine is a different curve. Everyone's body is different. So, it doesn't, what might work for you, the best might not work for the other person.
I'm just sitting and listening to you. I'm one of those characters who thinks what we get online is the best solution. I'm always on Amazon looking for stuff. And to think that we actually have all these tools right in our house, like you said, the towel, I'm like, we should get a proper back support because you need it so that your back doesn't bend. And as you said, I'm going to try this the next time, because what I did where I'm sitting now, I'm pretty much at eye level, not exactly, but almost there. I'm slightly higher actually. But earlier, I was much lower and I was training by looking up. And then I went suddenly too high and I was looking down, as you said. So I brought a bar stool that I'm sitting on right now. So it's given me a little bit of, I would say, eye contact with the camera as well, which has helped quite a bit. But this towel thing, I'm going to try definitely. And by the way, just a quick thing again from another guest we had on our show, Piki Nanda. Thanks for joining in. So nice to see you. She's here every week and she supports all our guests and all our people on TNG as well. Piki was with us a few weeks ago. She's a transformational coach, lives right here in Dubai. Very nice talking to her. She just asked me, is ortho, oh, by the way, Noah, thank you, Noah. It is quite clear, actually, the audio. I think the net was breaking up slightly, but not as bad as it was when you had your earpiece on. So I think the audio is a little better now. Piki asked, is ortho and RA connected? Do you deal with this and how?
Sorry, I can't hear you.
Is ortho and RA, are they connected? And do you deal with this and how?
Ortho. Did she say ortho or
Yes.
osteoarthritis?
No, she says orthopedic, okay. I think, yeah.
Yeah, orthopedic, yeah. So, yeah, we just spoke about RA, right? Like rheumatoid arthritis, where multiple joints are affected and you need to work on the stiffness of each particular joint. So when it comes to RA, even you have to work at the smallest possible involved. Like, you might not think like fingers have how many joints involved. So, you work at each specific joint, like even the wrist, even you're working at the elbow, then you're working at the shoulder, you're working at each specific joint. And when it comes to osteoarthritis, it is one specific joint, like a knee joint, and it mostly happens like it's a degenerative problem. It's like an age-related degeneration, which normally happens to everyone at a certain age. Like, once you cross like 35, you start developing like in X-ray. That's because of your degeneration of joints. That's like a normal process which happens to everyone, like this are developing. But RA is something which happens rare, and yeah, like how do you identify RA is, when you start noticing that both the sides of your joints are swollen, or you start experiencing stiffness. So you come to know, that's RA. And when it's osteoarthritis, you'll come to know it's one particular joint which is giving you the problem. Okay. So you're limping on one side, or that it's one specific joint, and these are multiple joint involved. So that's the difference between them.
Nice. Sharon says, fortunately, although my mom uses a walker, she has always been a positive person, and that makes a huge difference. Yes, Sharon, I think that's what even Dr. Venetia said. It's about our determination. It's about us being positive. I think a lot of our problems will be taken away with these few things. Where we ourselves should have belief in our own selves. Yes, we need to be positive. We need to be determined, because with this we can help. Doctors there, yes. I mean, the doctor can always give us advice, help us, do physio, provide medication and all that. But if we don't, as Dr. Venetia said, if we don't trust and believe in our doctor, the doctor can't do her job as well. So when she spoke about this lady who was bedridden literally at home for 25 long years, I mean, that's a long, long time. And, it was not only her determination, but also Dr. Venetia's determination, because she had to spend 5 years with her. And today you brought her to, I mean, being independent using just a walker. I mean, I would call it a miracle, but I know it's not just a miracle. It's a lot of hard work, determination, being positive. And it's two people who work together to make this happen. Well done, Dr. Venetia. That was good. I asked you that question. And I think a lot of
you. Thank you all.
I'm telling you all, I mean, this is what it's all about. Have faith in yourselves, first of all. Be determined, because this is what it is all about. And then when you have somebody like a Dr. Venetia, it's going to help a lot. And I think together, when you work, as one team, I think there is nothing that is impossible. Everything is possible. Having said that, I wanted to ask you something else. I was going to ask you about tips for people working from home, but you already answered most of it, because a lot of people today are sitting at home, right? Uh, Basically, because of lockdown and because of Corona, the whole of last year, everyone is sitting at home. So obviously, you become lazy. You don't do exercises. You eat more. You're stressed more. You're worried. You're tensed, and that's why TNG started, because we wanted people, to come out and showcase talent, so we could be there to motivate them, at least to take their mind away from all the pain and the struggles and stuff like that. But besides that, you may spend half an hour on TNG, but you still have another 23 and a half hours, a few of which you sleep, and the rest of the day maybe doing nothing. So maybe a few points, if you could give people who are at home, to tell them, uh, especially because they are working from home, like me. I mean, I'm sitting all the time on the laptop. I get tennis elbow. I get issues with my fingers, my thumb, and the index finger especially. And it's only because of this constant punching away, constant typing away, and there's nothing else to do. So I definitely have issues. Before I get you to answer that,
Yes.
Hi, Lyndon. Thanks for joining us. Lyndon is asking, so swinging the arms, fighting, is a good exercise. Just kidding, he says. So he says swinging your arms like fighting.
No, but Alvin, as you said, like working from home, I'm here. So I'm going to give you few, exercises. Like while working from home, when you get a lot of neck pain, what quick exercises we can do, at that particular moment, you just can't, go and take a painkiller or something. If you try to do a lot of these exercises, you'll avoid neck pain. And then, I'm going to give you a few tips. As you said, I'm here for it. So like, why not do it? So help all the people on TNG. So I'm going to demonstrate. I'll demonstrate myself few exercises, and I'll tell you what can be done.
Oh, lovely. So you know what I'm going to
All
do?
those people who are like continuously slouching, can you hear me?
Yes, we can, but I'm going to put you on. Let me pin it, because I'd like to get you on speaker view so everybody can see you. They don't have to see me. So everyone, please keep your eyes on your screen and watch these few simple exercises that Dr. Venetia has been very kind enough to actually show you all. And this is coming to all of us for free. So please watch this. It's very important. Over to you, Dr. Venetia.
Okay. So like most of us, continuously while we're sitting at home, we're slouching and we're sitting. We're putting a lot of stress on the neck, on the back, and plus shoulders and lower back. So automatically when you're slouching full time, you're putting a lot of stress. As you know, you cannot completely sit erect full time. So let me get for some, like I'll show you in sideline position the demonstration of how do you do a chin tuck. The simple thing is just keep your hand here, okay, and just mark the level of your chin. Now, what you're going to do is keep your body straight and erect, and you're going to push. You're going to tuck your chin inside, and then you're just going to hold 1, 2, 3, 4, 5. I think Alvin, you should do it with me. Okay. Again, just sitting in this upright position, just tuck your chin. 1, 2, 3, 4, 5. Relax again. Again, chin tuck. It's a very simple exercise, but it stretches and strengthens your neck muscle. And you can do it whenever you get time. The second one you need to do is a stretch. I'm going to show you everything in sitting position because I know most of y'all do not even get the time to get up, even in those 2 hours. So, 2, 3 hours continuously meeting, I can totally understand. Working from home is never ending work. So we'll do exercises which are directly sitting on the chair. So what I did is now I'm going to hold the chair one side. Then I'm going to hold with my other hand. Like suppose I need to stretch my left side. Okay, left side. So what I did is with the right hand, I'm holding, okay, and here this hand I'm holding the chair. Okay, holding the chair. And now I'm going to stretch. 1, 2, 3, 4, 5. Remember, while you're stretching, don't just do this. You need to hold the stretch for it to be more effective. So as I said, the shoulder will be lower. Then I'm going to hold this and I'm going to stretch. 1, 2, 3, 4, 5. Even the same way for the other side also. You're going to hold again, stretch. 1, 2, 3, 4, 5. So I said one was the chin tuck. Chin tuck is very simple. You can do it whenever you have time. And I said the second one was the stretch, so that this muscle doesn't tighten. The moment the moment this muscle starts tightening, you start getting neck pain. And sometimes you have this soreness here, this stiffness, and then you cannot even leave the bed early in the morning because of that intense pain. So this is a simple stretch you can do whenever you have time. The third thing you can do is just squeezing your blades, your shoulder blades. You just need to squeeze them. Now, how do you do that? Is just keep the position till your shoulder level and squeeze it backwards. And again, 1, 2, 3, 4, 5. Again, back. As I told you, squeeze your blades. 1, 2, 3, 4, 5. They look simple, but if you have pain, they are very effective. And plus, a small thing you can do whenever you have time is just roll backwards. Backward roll. Okay. So instead of forward rolls more, a backward roll more will help, in easing out the pain and symptoms. So you can do this, whenever you have time, say, just 5 minutes it will take, not even 5 minutes, you just do it. But you can avoid any neck issues later, any impingement, radiating pain. All this can be avoided with just these 5 exercises. To do them at regular intervals. Like this is really effective for people working from home. And I also say, like, there's this simple rule. Now, mostly you're working from home, so you don't get times to take break, and you'll experience some itching in your eye, redness in your eye. That is because of excessive screen time. Now, one important rule. It is called the 20-20-20. Very simple. Every 20 minutes, okay? Every 20 minutes, you take a 20-second break and look 20 feet apart. It's like an eye exercise, okay? So every 20 minutes, you just look 20 feet apart, okay? Just take a break for 20 seconds. So at least the pressure on your eye doesn't increase and you don't get that redness, itching, watery eye, which most of you experience since you have excessive screen time. So simple tips, if you could, and even just stretch, if you have a towel at home or anything, a scarf, like, you can just do a simple stretch, like stand your shoulders and just like raise them, raise. So now you like simple thing, if you could just do, you'll avoid a lot of these back and neck issues. And I told you the same thing, roll the towel up and keep it in your back. Yeah, so some important exercises I gave. I hope it will be helpful to all of you.
Thank you, thank you, thank you. While you were doing that, I actually got you to be spotlighted, obviously, because I wanted everyone to see you, no use of seeing me. And I was trying to do what you were doing sitting here, so nobody could see me there. But I tried to do a few of the tips that you were just giving out. Thank you for those tips, because honestly, a lot of what you just said are things that I need to do because I experience almost everything that you mentioned about, especially with the eyes. Even right now, see, I'm talking to you continuously, looking at the screen, looking at my phone, which is right next to me, and my laptop. Yeah, continuously looking at it. My eyes are burning and watering as well. And it's a good thing, like you said, every 20 minutes to spend 20 seconds away and stay 20 feet away. Wow. I'm going to keep this in my mind. And those exercises were awesome. Actually, Dr. Venetia, last year I remember that I spoke to you and you were very helpful because I told you about an issue I had with my neck because of a car accident. And you told me, listen, don't worry about it. I'll take care of it. And you said, I'll give you simple exercises. I remember this, what you just mentioned about the chin part of it, what you told me. I did try it for some time. And then, lazy people like me, I'm a lazy man. I suddenly did it for some time and I stopped it. But when I did it, I did feel much better. But I was supposed to talk to you actually once again after that, and you were supposed to give me some exercises, which I'm going to take you up on sometime if it's okay with you. I would love to get on a Zoom call with you, and I would definitely need some.
I'd be happy to help.
The neck, especially. I'm going to take you up on this because very interesting the way you just showed us now. I mean, it looks so easy, it's so simple. All we need to do is determination. We've got to put our head to it and do it. And if we do it right, I don't think we're going to suffer at all. We're going to be really having a great time. So thank you for those tips. It was really, really nice. I want to ask you now, by the way, would you like to take a quick break to get a glass of water or something, or maybe a nice hot cup of tea, since it's Tea Talk with TNG? If you would, then I don't mind going in for a quick 30-second break.
It's already there.
It's there. Noah, I'm sure, has been taking care of you. Okay, go ahead and have a sip. Feel free, because I was actually drinking water while you were talking there. I don't know if this is part of your scope of work, but do you, by any chance, have any advice for parents with special needs kids? Do you actually work with special needs kids?
Yeah, I do a lot of awareness.
Oh, nice.
On disability, and I always tell the kids with special needs, it's always better to do an early intervention program. So the earlier you're able to identify the problem, the earlier you're able to. So when I get a child who's almost 3 months and 6 months, it's easier to work and it's more faster to gain the milestones than later. It's easier and the process is faster. Plus, I want to tell all the parents out there, like not only special kids. So in children, like in 3 months, if you don't see that the child is head holding, or 6 months, it's not, your baby is not able to sit, upright, or crawl in 9 months, or like just stand in 15 months. If you see some kind of delayed milestones in children, it is easier, it is better to identify it early and and fix the problem. Or if you see that, your child is continuously holding the body very tight, or sometimes the child is very loose, feel very less toned. So it's easier to identify, so if you identify something is wrong, go to your pediatrician, and then your pediatrician will be able to guide you as to what you have to do. So, it's for like parents who should observe the symptoms at that particular time, because this is a very crucial period of milestone. And when you happen to, sometimes you just say, oh, nothing's gonna happen, just wait for some time, everything will be fixed. You can't, it's better to get a medical opinion. And if it can be fixed easier and earlier, it's better for the child and for the parent also. And it's quicker to get results. So one more thing I just need to tell children, like parents with special needs, like, don't just give up. Find someone who's going to be there with you throughout your entire process, and you will get there, and acceptance, and plus involving your child more socially is, when I have seen children who are intellectually brilliant, okay, they're just brilliant, and they're not going to school. Why? Because their parent thinks that they might need a special school. But it is not the case in every child. If you're intellectually good and just having some amount of physical impairment, everything can be fixed. So, you do not keep the child away from the social environment. The more you push the child towards the social environment, the more the child learns something from the other children and from the people around. So, I always say that social inclusion is the key. And we ourselves also know, when, like, a small tip, if you see someone who's differently able, don't continuously stare and talk to the parent. Sometimes the child can talk. So what people do, they ask the child, what happened to the child, how your child is like. This is not what the parent wants to know. You can sometimes just talk to the child. You can say, wow, appreciate the effort of the child. Wow, so nice, your kid is doing this. Oh, amazing. Wow, what a nice, progress or improvement. Half of the time parents don't take their children out because they're scared of the social pressure. They're scared of the questions to be asked by other people. Whenever you see anyone differently able, I expect people to be more kind, like in more encouraging way, not in the sorrowful way. Oh, I don't know what happened to your child. I pray that nothing should happen more. This is not the way you talk to a child, or a child or a parent with special needs. You need to encourage them. You need to motivate them, no sorrowful face in front of them. You need to be smiling, because they are smiling. Have you seen them? They're never sad. They're always smiling. So, just like I need to tell, since many people are watching, first of all, they have a lot of capability. So, stop judging and thinking that, this much is their capacity of doing things. So I think, more than educating them, we need to be educated on this.
Very, very rightly said. The most important thing I think with special needs kids is the acceptance part. We need to accept them in society. That's very important. They're humans. Some of them, I think most of them, are a lot smarter than regular people, regular kids and adults. They're very talented. God has given them a lot more talents, and they have a lot of potential in them. It's just that we need to recognize it, appreciate it, respect it, and accept them as they are. That is very important. Thank you. I didn't know that you work with special needs kids, but thank you for this. It's very important. In fact, there is a family, I think, who's also on TNG, whose two kids, they used to be in Dubai. I think his name is Brian, whose kids, a boy and a girl, fabulous. They won so many awards in skating, singing, dancing, and doing everything possible. I mean, they are in some ways better than regular kids, I would say. I would love to get them on our show, because probably, and I bring them on the show, I would also like you to be there, because it'll be really nice talking to them, and it'll be very good to even listen to them. In fact, there is also another kid. He's a teenager now. His name is Sparsh. I don't know if you all have seen him, but I see a lot of people on TNG who also follow him. I know him pretty well. I know his father. I'm trying to.
Yes.
Oh, you know him. Good. Okay. In fact, yesterday I was talking to his father.
Osteogenesis imperfecta.
Yes. You're going to love this guy, because I've been following him, and I've been wanting to bring him to Dubai for a show. Unfortunately, COVID came in, so I had to shelter.
Amazing. He's amazing.
Amazing kid. And I tell you something, I was talking to his father yesterday. I
Amazing.
want
Yeah.
him to come on one of our shows. He will definitely come on the show because he's such an inspirational kid. A lot of people are going to learn from him. So I'm going to really
Very
push
true.
this particular show with this kid, Sparsh. I mean, I love him. Great, great kid. He's going places. So thank you for this. It was really good. I was also going to ask you to give some advice to people with, but you already answered all of them, so no use. But I was going to ask you for some advice on people suffering from back pain, neck pain, shoulder pain, people with RA and knee pain and all that. But you actually pretty much, I think, spoke about every aspect of it, which is more than enough. We're coming to the end of our show, almost the end. I don't want to keep on taking your time, Dr. Venetia, but thank you so much. Just wanted to ask you one more thing. Noah, is he also involved with the business? I mean, is he also doing something with what you do, or is he doing something different? Or is he working somewhere else? What does he do?
No, he's into a completely different field. But yeah, my greatest support. So I need to tell you about this. Last year, just before COVID could strike, we did a marathon for differently abled people. With just three, the organizers were me, Noah, and my brother. Three people with a motive which we started from scratch. So what we did on World Disability Day, we had a marathon where we had 250 differently able kids run a marathon with the normal school children. So, there was no
Wow,
difference between both of them. And we had 1,000 participants. It was an initiative which was done for the first time ever. We had 1,000 participants, and it was such a great thing to watch. We changed everyone's mindset because they think that special kids with special needs cannot do it, and they all did it with crutches, all visually impaired people, and everyone with hearing impaired, speech impaired, even with cerebral palsy. People who walked up to 14 to 15 years. We had a 1 kilometer marathon for people on crutches and walker. But there was also a guy who, like a boy who did a 5 kilometers marathon, and the visual impaired did 10 kilometers marathon. Can you imagine? And I'm telling you, they were the winners. The other people couldn't do it, but they did it. So it was
nice.
such a different experience for people who thought it was such a beautiful experience for people who thought that, they cannot do it. And so nicely, I love the involvement, the joy on the parents' face you could see when you see your child with the normal other school children. We didn't want to create a difference. So that is what is social inclusion. So I'm really working for this cause since years now. It's been 10 years, and we've been doing a lot of awareness. So this was like a thing which was always on my mind, and we just happened. But sadly, due to COVID, last 2 years we couldn't like this year also. I don't think it's happening, and last year it didn't happen. Otherwise, that event was so beautiful. I'm telling you, Alvin. I don't know. Next time, I think I'm going to call you in for it. And you'll see the joy. I mean, it was such an achievement to see everyone, everyone like an inclusive society dancing together, like walking, running together. It was beautiful.
I give you my word. The next time you do this and organize it, invite me. I'll be there.
Oh, I'll be so happy to have you, Alvin, because
I'd
I
love
know
to be
that
part
you'd
of
never
it.
say no for any initiative.
I'm just reading here. Lyndon Pereira says, I wish you can do that marathon in Dubai. It will be very much appreciated and get better recognition. And I think it's a good idea because we do have a few schools over here for special needs kids. And I think it'll be a great idea. And what you could do is share something
Yes.
with me on this marathon that you've been doing. I will talk to one of the schools. It's called the Al Noor School over here, as well as the government hospital. Rashid Hospital has a department as well for special needs kids. Maybe a
Okay.
good idea to talk to them and probably do this every year over here. It'll be great to do something like this because someone like you, with the kind of work you do, I think it's awesome. I don't think 1 hour is enough for us to talk to you because you have so much in you. There's so much that you can give. And there's so much more that we need to talk about. I think we'll have to have a second episode with you because I don't want to bore our audience sitting there for over an hour. And you, of
I'm
course,
never ready. I'm always charged.
Good. That's
I'm
nice.
always in for it
That's
already.
very good. Oh yeah, Lyndon says Dubai Autism School in Garhood also. Lyndon, I guess that I see that you're in Dubai, so maybe you should get in touch with me. Together, let's talk to Dr. Venetia and try and make this happen here. I think it'll be a good idea once everything
I'll
opens
be very
out.
happy. We can do it together. It would be
Awesome.
amazing because I've been
Awesome.
working on it since a long time, and wherever possible, we've been doing awareness, even at the smallest scale possible level. And when we did this marathon, also, we thought we'll get such a great response. And I'm telling you, we did this all by ourselves. I and my husband and my brother went to each and every school personally. No one doing it for us. So, we had the personal touch in this event, which is more easier, to get results. So it was so good. So I would be so happy to be, connected and more people involved for the cause. It would be, we could spread our message across a little bit faster and it'll be amazing.
Awesome. Really nice. I mean, there's so much in you. I never expected this much from you. Honestly, I'm telling you, because what I knew of you when you started on TNG, first of all, we should be grateful for you having come in and joined TNG. I think it was Jude, or I don't know who invited you, but whoever invited you to join TNG, I must thank
Yeah,
that person.
Jude added me to this
It
group.
was Jude. Okay, I thought as much. Hey, bro, Jude, I wish you were here. I think he's doing his show, but Jude was the one who brought you in. Thanks, bro. It was thanks to you thanks to Jude that we got Venetia in. And I saw and knew
Yes,
of you
thank you, Jude,
when
for
I
adding me.
no, when I saw you post your dance video, I was like, man, this woman, I said, she's got so much of energy. You have so much of energy. You danced and you were really a live wire. And I never knew the doctor side of you. I thought you're one of those young girls, probably working in a corporate environment or something like this. Had no clue that you were working I mean, you're a physiotherapist, you had your own clinics and you're a doctor. I had no clue whatsoever. Lyndon, I'm going to take you up on this. Lyndon, do get in touch with me. He says that, yes, for sure, we can get the Dubai government to support this as well. So I take you up on this, Lyndon. Get in touch with me. I'd love to talk to you and let's see how we can do this together. I need a few people to join hands with me. That's very important. Coming back to your dancing, Venetia. Now I stopped with the doctor side of it. Let's leave the doctor part, your profession. But I think now I'll call you Venetia because I know that you're a great dancer. And I haven't forgotten when you told me that you were also a child artist. I know that you posted your videos on TNG. You also participated in our dance contest. You didn't want to initially, you were all nervous and stuff, but you came in there, you gave it your best shot. But again, that contest was the only one we ever did, never will do it again. At what age did you start dancing? And you did mention you were a child artist to me once. At what age was that? And do you still dance, by the way?
I still dance. I still dance means I started actually dancing in lockdown again, and I still choreograph. So I figure out time. Sometimes if I have to choreograph something and I have no time in the day, so I like wake up more early and I call all those people for practices early just because I have to reach clinic in time. So I still have my dance passion. That is something which you can't take away from me. That's the only thing which makes me happy. So when I was small, I worked with Shah Rukh Khan. Like I had danced in movies like Ashoka. I danced as a child artist in movies like Ashoka, and I Aishwarya Rai, Abhishek Bachchan. I saw all of them as a kid. I danced with them in different movies like Kuch Na Kaho, and I did a lot of advertisement. So when I was a kid, like I was more into dancing and even into school. Like studies, yes, my parents never forced me to do anything. They used to be super supportive. Do whatever you want, do whatever you like. So dad was like, do whatever you want. Mom was like, do whatever you want, as long as you're studying and you're getting things done. So they were really supportive. And I think I don't even remember the age I started dancing. I think I just came out of the womb. I got some stability and I started dancing. I just love music. I could just dance on anything. I was a part of, I don't know whether you've heard of this show. When I used to dance, there were not much reality shows and all. But Boogie Boogie, I was a part of Boogie Boogie for many times, for many
Yeah.
years. Yeah,
Javed
I
Jafri and Navid Jafri. How could I forget
did.
that?
Yes, yes, exactly. Javed Jaffrey, Javed Jaffrey. I was in All Mumbai Dance Championship. I won it for like 2 consecutive years.
Oh,
I used to do a lot of Rotary. Yeah, I did a lot of Rotary Club functions, and I worked with choreographers like Geeta Kapoor, like now.
uh, we just lost you there. We lost your audio. Can you hear us? Can you hear me? We just lost you.
You can hear me?
Yes, now we can hear you. You're
Yeah.
right. Yeah.
So I worked with Geeta Kapoor, Weber Merchant, all Farah Khan, all well-known choreographers at that time. And no one ever thought that, I would go into a medical profession because I was always dancing, always up for everything. And so both happened to me and both are very close to my heart. So I'm not leaving both simultaneously. I'm going to keep dancing also and plus continue my profession. So that's the way
Superb, superb. I mean,
that.
you've danced in some fabulous movies, I must say, and you met a lot of the Bollywood celebrities. You danced with them, and you also participated. I used to watch Boogie Woogie regularly, by the way. And
Whoa.
Jawed Jaffrey is a friend. I've met him many times in Dubai. He's a friend even now. The last time he was here, I met him. Sad that show actually went off air because it was a good show. And now that you love dancing so much, by the way, before I get to the last part of it, would you like to share your YouTube name that you go by, Insta if you have a handle, and your email address so people can get in touch with you? I'll just put you on spotlight, so please go ahead. Over to you.
You type it. Yeah.
Yeah, you can type or say it. Maybe you can even
Yeah.
say it, or probably Noah can type it while you say it.
Yeah, he's doing it.
All right, so he's typing it, then we don't have to say it. So those who are watching,
So
kindly
on YouTube, yeah,
go ahead.
on YouTube, I share a lot of health tips or a lot of about posture, about neck pain, about knee pain. So if any one of you, just wants to go back and just scroll through my videos, you'll get an idea about what can be done. I've demonstrated each and every exercise by myself, so it's easier to understand and kept it as simple as possible. No, I always believe that, when you speak to people, you have to be as simple as possible. And the instructions have to be very clear so that, there's no confusion in how you have to perform the exercises.
Lovely. So I just see that Noah has put up the YouTube channel there. Please go and follow her. Not only following, of course, you get to also watch her videos where you can learn a lot and gain a lot by watching the videos. So you're not just going and subscribing to her video to give her more members. It's obviously going to be a benefit to you. I'm going to subscribe to your YouTube channel for sure. Noah, please put up also the, if she has an Insta handle, please put it up. And do put her official email address so people can get in touch with her should they need some one-on-one counseling or physio or advice or whatever. Teresa's just come in. Hi, Teresa. Teresa's a good friend of mine from Bangalore. She's over here. Thanks for joining in. I saw Nancy earlier. Nancy's from London. She's a college mate of mine many, many years ago from Bangalore. She's in London now. Thanks for joining, Nancy. Before we end the show, Venetia, I'm not going to call you doctor anymore now. I think the doctor part is over with our professional discussion. Venetia, I know you love dancing and you were not prepared for this, but I don't know if you're ready to show us a few steps like you showed us a few exercises. And if you are ready for it, feel free, but no pressure whatsoever. After which I would like to say thank you to you. And of course, thank you to all our guests, viewers who are watching us tonight. And since Noah has been working hard behind the scenes over there, he's been your videographer, photographer, typing out everything for you. It'll be nice if he can come in and show his face and say hello to everybody as well, if he feels like. I would like to say hi to him.
Noah, would you like to say hello? He's not coming.
Come on, Noah,
He
we want to
likes
say
to
hi to
always
you.
be behind the scenes.
All right, no pressure. We don't want to
He
force
loves
it.
to always be behind the scenes.
Cool, no problem. But you know what, Noah, thank you so much for the support. Thank you for supporting your wife and for helping her in what she's doing because she deserves support. She needs support. And without family support, I don't think we can do anything. Family support is very, very, very important. Thank you for that, Noah. Big hand to you. Well done. So Venetia, Dr. Venetia, thank you so much for your
And
time.
one more thing before I end this,
Sure,
Alvin,
sure.
just a second. I just want to say a big thank you to you for inviting me to this show and, for inviting you. You're doing such a great job, getting people from different places, different talents together. I still remember when I joined TNG group, I was the only dancer. And you said, so what? This group is welcome to everyone. And, you were so kind, you were so encouraging. There were days, when I was really sick and I was like, I can't perform. And you were like, you can do it. You've been so encouraging and motivating. I've actually seen people grow in TNG. So you, Lester, Roland, you all are all three of you are doing such a great job, getting people together. I just want to tell you all, like, keep doing the same thing what you're doing, because you all are so positive, and the positive atmosphere you all have created for all the people who are talented is just amazing. I've actually seen people grow at TNG, and uh, a big thank you to you for doing this. Especially during lockdown, where most of us were sitting at home and we were really sad, and we were very uncertain about what's happening next. But thank you for creating this group. I get to know a lot of new people here. I've come in contact with such wonderful people from this group, connected with them, made some new friends, and thank Jude for connecting me to this group and getting in touch with wonderful people like you all. I just want to say a big thank you for doing that.
Well, I have to say thank you to you for acknowledging it and appreciating it. Like you, there are many others, and all I can say is we did our best, we tried our best, and I hope we're doing our best. Yes, it's not only me, Lester, and Roland, but it's a lot of the others also. We have 15 or 16 moderators. I can't take all their names, but thank you. I should say thank you for acknowledging all of us. And thanks to all my moderators and admins who are doing a great job. And it's not only us, but it's also people like you. I mean, it's the entire family, like I call my family, you know, that all the 12,000 plus people we have, they're family to us. And we call them family because each one means a lot to us. And when I don't see someone performing or showcasing or communicating or commenting, you know, for a week or 2 weeks, I get worried. I actually write to them and ask them if they're okay. That's what I do. And yes, I remember I pushed you without pressure and without getting you stressed. I remember when you were sick, I pushed you to come and take part. You were worried. You said, no, 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 I'm not going to do it. But I said, listen, nothing is wrong. Just go ahead. You did it. You did your best. And it was really good that you came and performed. And even a few weeks ago, you were supposed to come live, but you felt sick. You didn't feel good because of your vaccination. And it was last minute. We had to cancel your show. It didn't matter. We brought somebody else. But at the same time, no pressure. And I was glad you accepted our second invite and you came back today. And I'm going to send you a third invite because I want you to come back again. There's a lot, not only that I gained from this, but everyone watching. And there are more people going to learn a lot from it, Dr. Venetia, because after the show is over, I'm going to put this up on YouTube. I will send you the link so you can share it. I will put it on our groups as well. So those who didn't get to watch you live can watch you after that at their own convenience. They can sit at home and watch this entire episode. Dr. Venetia, a big thank you to you. But before I end, I want to tell all our viewers, including you, if any of you know of a good counselor, please put them on to me because I would like to bring a good counselor on our show. A lot of people, I think, need counseling. A lot of people need some tips. A lot of people need someone to talk to. I'm one of them, to be very honest. I also need counseling. It'll be very nice to sit and talk to somebody. Yes, I thought I was good. I've inspired people, motivated, I've uplifted, done a lot of things that I thought I was doing right. But end of the day, when I watch people like you, I also get inspired. I also get motivated. I also get uplifted. And I definitely can do with talking to somebody. So please keep your eyes and ears open for a good counselor. Anyone knows of one, please get in touch with me. Noah, I see that he has been putting up your Instagram handle. He's put up your email. He's put up your Facebook, your YouTube. He's put all the details. So please get in touch with Dr. Venetia. Very inspiring lady. Thank you very much for coming on our show today. Thank you again, Noah. Before we leave, I just want to say, before we leave, of course, you're going to come and show us a few steps. I don't have the music for your dance, but if you have some music, and if Noah's ready, he can play just one line for you just to show a couple of steps. But before that, I want to say thank you to all our viewers. Thank you for watching us today. Do tune in for future episodes. Next week, next Friday, we've got a great speaker, coach, and a businesswoman and entrepreneur who's a Singaporean Canadian living in Dubai now. Her name is Belinda Lee. You're going to enjoy, our conversation with her for sure. Next Friday is going to be a great evening as well. Thank you, everyone. Please take care of yourselves. Stay safe. You'll have learned a lot of tips from Dr. Venetia on our show today. Put them into practice. Don't just listen to them and throw them out from the other ear. Make sure that you put these tips into practice. And when you need more help, get in touch with this young lady and she'll be there to help you all as well. If you know of anybody else who needs help, please get in touch with her. Stay safe. Make sure that you continue wearing your mask, continue sanitizing yourselves, continue staying at home if the need doesn't arise for you to go out. Continue to take care of yourselves because you are also taking care of your family, your neighbors, your friends around you. And together we can make this a healthy place to live. COVID has to go. Dr. Venetia, thank you once again. Lots of love from all of us at TNG. I see all my guests over there and my viewers also saying thank you so much. Now it's over to you. Before I end the show, give us at least 2
Thanks, Alvin. We love you.
Hey, Noah, then I hear your voice. Thank you so much, Noah.
Thank you so much.
There you are. Finally, we get to see him. Thank you. You know what? I really appreciate all the work you do, man. Thank you so much. I look forward to meeting you too one day in person.
Thanks, Alvin. Thanks to the entire TNG family.
Thanks to the entire TNG family, Lester, Roland, everyone. Thank you so much. You guys have been great support and, constantly always in touch. Thank you. Have a great day.
Thanks a lot. Thank you so much. Yeah, it's quite late now. I think for you guys, it's almost 10:30 or so. So with this, let's end this evening. If you feel like getting up and doing a few steps, I'll wait for that. Otherwise, I'll be ending the show in the next couple of seconds. Thank you again.
We'll have one more episode for that, Alvin, especially for the dance one.
Done. As I said, I never put you under pressure because yeah, I put you in the corner. I know I put you on the spotlight suddenly. Normally, I don't put anybody under pressure, and I wouldn't do that with you either. But when you are ready, we'll bring you on a show where you'll dance and talk to us as well about your profession again. Thank you so much again. Stay safe. Take care. Big hug to you and Noah and your family. And we'll see you soon again. All right. And let's bring your show to Dubai. We'll do the marathon over here.
Bye.
Take care. Good night.
Thank you. Bye.
Thank you, everyone. Good night for now. Bye. See you next Friday.